In this Chemscape presentation, we will be learning about aspiration hazards. Aspiration means the entry of a liquid or solid chemical directly through the oral or nasal cavity, or indirectly from vomiting, into the windpipe and lower respiratory system. This can result in severe effects, such as asphyxiation, chemical pneumonia, lung injury, or death following aspiration. An aspiration hazard is classified as a health hazard with this GHS pictogram. A chemical is classified as an aspiration hazard based on its thickness or viscosity. Products with this hazard may be fatal if they are swallowed and enter the airways. There are two categories of aspiration hazards. Category 1 has a warning label of may be fatal if swallowed and enters airways. Category 2 has the warning label may be harmful if swallowed and enters airways. Both categories refer specifically to substances that cause damage or even death through toxicity. Products can also be aspirated indirectly if an individual vomits an ingested substance with an aspiration hazard, either because the substance induces the vomiting or because vomiting was purposefully induced as an attempt to get rid of the hazard. This is why it is very important to follow the first aid instructions on the safety data sheet for a product if it is ingested, or to call a poison control hotline. Some common products we use every day, like gasoline or diesel, nail polish remover, lubricants like WD-40, or paint thinners, have aspiration hazards. Children are particularly susceptible to health effects if they inhale these hazardous products. Let's now review some best practices on how you can protect yourself from exposure to aspiration hazards. The best place to learn more about the chemicals you work with is to read Section 2 of the safety data sheet. Think if you can use a less hazardous product for the same task. Can you eliminate, substitute, or use less of the product for the task? Follow the guidelines on the safety data sheet for recommended engineering controls. As a best practice, general ventilation is recommended to reduce any droplets in air when working with these products. If the application involves spraying, local exhaust ventilation, or other engineering controls to maintain airborne levels below recommended exposure limits. When working with aspiration hazards, wearing personal protective equipment, PPE, including the recommended respirator, is essential in preventing exposure. It is critical to follow the controls that have been recommended for the job. When using PPE as the control measure, workers should remember that it is always a last line of defense and must not be used exclusively in high-risk scenarios. Use the recommended respirator to prevent these viscous liquids from entering your airway. Your respirator has been selected to protect you from exposure for the substance being used, the task being performed, and your individual face and fit. Inspect your respirator for any damage prior to each use. Conduct a simple negative pressure seal check and a positive pressure seal check to confirm proper fit. Clean and disinfect after each use. Store in a clean location when not in use. Observe good hygiene practices to control exposure to hazardous substances. Wash hands after handling the material and before eating, drinking, and/or smoking. Routinely wash work clothing and protective equipment to remove contaminants. No eating, drinking, chewing, or smoking in the work area. Dispose of contaminated work clothes in the labeled and approved container. Stay safe at work so you can stay healthy in your personal life. If you have further questions regarding this topic, please contact your health and safety representative.